Yeah, my name is Dr. Tom Zdeblick. I'm an orthopedic spine surgeon. I'm affiliated with the Orthopedic and Spine Centers of Wisconsin group in Madison, but now working at the Beloit health system. So I've been involved for 34 years in treating the entire spine for mostly degenerative conditions, some traumatic and some otherwise. That includes the cervical spine, the neck, the thoracic spine, and the lumbar spine, your lower back. But it's really all conditions, particularly pinched nerves, bone abnormalities, things that cause pain in your arms, legs that are coming from your spine. And I really pride myself on looking at all modes of treatment, keeping surgery as a last resort to how we get people better, and only offering surgery when I'm very sure, 90% or more, that we'll be able to help a patient with spinal surgery. Yeah, I grew up in the city of Chicago, inner city at first, and then eventually in one of the suburbs of Chicago. I first entered into Wisconsin as an undergrad at Marquette University, where I majored in engineering and played soccer. Then I went to medical school in Boston at Tufts, did residency in Cleveland at Case Western Reserve in orthopedic surgery. And then I trained at Johns Hopkins for a year in both neurosurgery and orthopedic surgery, but only for spinal conditions, as a combined fellow. And after I left Baltimore, I came back to Wisconsin and was at the University of Wisconsin for 34 years before I retired from the university in 2022. Decided I wanted to continue to practice spine, and so now I've joined the group of Orthopedic Spine Centers of Wisconsin, and I'm working out of the Beloit health system. Well, the most important part of patient care is listening first and really hearing what's bothering a patient. There's so many factors that go into patients and pain and struggles. I coined a term years ago called spinechiatry, which is a little bit funny, but it really means understanding a patient about why their back or neck are really bothering them. Not just understanding the MRI, but their whole life situation, and trying to coordinate all of that into a treatment protocol that makes sense to them, so that they're on my side, I'm on their side, we work together to get to a good result. So the group I joined, OSCW, is really committed to bringing timely care to smaller communities outside of Madison. We've been working in a number of community hospitals so that patients don't have to travel as far or wait as long to get their care. I think the patients around Beloit deserve that. They don't need to wait that long to get care in Madison or Rockford. And so by coming here, I think we can provide a much more timely and effective way to treat them.